So the Premier of Gauteng says our province is a dangerous place to be right now. The head of South Africa's Medical Research Council says Gauteng is a catastrophe. That's as we grapple with a vicious third wave of COVID-19. Let's get a view from the hospitals now. And I'm joined by Dr. Jeremy Nell, Infectious Disease Specialist from Wits University, and he is with Helen Joseph Hospital as well. Dr. Nell, thank you so much for your time. I wonder if you could just tell us a little bit more about what things are like at Helen Joseph Hospital at the moment.
Yeah, thank you. I think the situation across the province really, not just this hospital, but pretty much every hospital in Gauteng at the moment is really an absolute disaster. And the reason for that is the enormous number of patients who have COVID now and who've been recently diagnosed. We're seeing in excess of 7,000, 8,000, 9,000 new patients diagnosed every day in Gauteng at the moment. And the hospitals aren't able to cope. We've got more patients currently in Gauteng who have active disease than we had with either of the first two waves. And that situation's been compounded in southern Gauteng by the closure of Charlotte Maxclinke Hospital as a result of fire damage, which has put even more strain on the already desperate hospitals. So we are overflowing with patients at the moment, and people who need oxygen are often find it difficult to find a bed throughout Gauteng. And people who do get to hospital often end up waiting days sometimes for a bed, although they are cared for as well as they can be until they get that bed. But it is a disaster at the moment.
So what is happening in your ICU wards? Is your ICU ward completely full?
It is full and has been for over a month, and the problem, as you can imagine, with closing a big tertiary hospital like what happened due to the fire, is that it's beyond just the extra beds. It's the huge ICU capacity. That hospital had about perhaps 80% of the beds, the ICU beds in southern Gauteng, or at least among the tertiary hospitals. And its loss is really not, we haven't got a single extra really ICU bed that's been made available to compensate. So the ICU situation is dire, but it's more than just ICU. It's also the general wards itself, and even the oxygen consumption, which is at the all-time high, just suggesting that people are coming in late, and they're coming in only when they desperately need oxygen.
Helen Joseph is one of the hospitals that had water supply problems. What is the current situation regarding your water?
Yeah, the water supply issue is fine for now. The issue was really on the municipality side, as I understand it. The hospital did as well as it could. We were shifting litres of water up to patients a day. But again, it just compounds the issue and further delays further issues. And again, to emphasize again, the problems are not solvable at the individual hospital levels. The individual hospitals are doing brilliantly. The problem is that we don't have enough beds in the entire province, and we've got facilities which are promised for COVID, like ABT around Barra, and places around Bronkhorstspruit and around George Macquarie, which are sitting idle and not utilized, despite the enormous number of beds that we currently need.
We've been speaking to reporters for weeks, and they've been telling us consistently they haven't seen activity around these extra wards. We know that, of course, some of those wards at the Barra 500 facility are now working, but they're not, as you say, the entire system is not up and running. What do you attribute that to? Do you think that's just a massive shortage of resources, or is there a massive failure of planning?
Well, I think the limiting factor in many cases, not the only factor, but the limiting factor is often staffing, that the facilities are built and sometimes even equipped, but without a good plan for sustainable staffing. And that is admittedly difficult in a disease which comes in waves. So there may be periods where you need it and periods where you don't, which is difficult to staff. But this is what the good planning requires. And as you said, we've been seeing these enormous numbers for weeks now. And to have facilities, as you say, ABT facility at Baragwanath is operational, but only at something like 25% capacity at the moment. That is incredible, seeing the number of patients who need beds currently. And we hope that the announcements made today in terms of the involvement of some of the military personnel, many of whom have medical training and can assist, will aid us. But again, we would love to have had that in position weeks ago rather than now. We really are desperate.
What are the next few weeks going to hold? What do you expect? Do you think it's going to get worse before it gets better?
I think inevitably, yes, because the caseload is still shooting up at an exponential level at a rate we've really not seen in this province before, and indeed perhaps not in any province. And there's always a bit of a delay between diagnosing cases and them ending up in hospital. That may take a week or two later, as that's typically when the severe disease hits, if it does hit. And so what we expect is that it's going to be worse for the hospitals increasingly, at least for several weeks, until the peak is reached. And that's going to be really dire for many, many patients. I mean, we're hearing reports of people trying to manage themselves at home because they're so scared of coming into hospital, or there just isn't a bed in the private and the public sector. And again, these are not solvable at individual hospital levels, many of which most of the hospitals are doing a brilliant job and working extended hours. The challenge is really to do it at the provincial level, and to make sure that the plans are available, to make sure that we have these extra beds that are available.
Already we know that the third wave in Gauteng is worse than our first and second wave, right? So I'm presuming this is the worst you've seen it in Gauteng. Do you know how it compares to other provinces? Have you heard worse stories from other provinces with previous waves? Or do you think this is about as bad as it's ever been?
Well, it's about as bad as Gauteng's ever been. At the moment, Gauteng's making up about 70% of the new diagnoses each day. So it's certainly, in terms of numbers, well ahead. But there are provinces, although less populous provinces, with smaller absolute numbers, which have been hit hard. I mean, the Northern Cape, for example, had a higher rate of COVID than it's ever had in the third wave currently. So I think a lot of provinces are struggling, just in different degrees, and others will still struggle yet, in the sense that many are going up and are presumably we'll have to see how high they get. But it's not just Gauteng, although Gauteng is leading in terms of the absolute numbers and in terms of the dire situation at the moment.
All right, thank you so much for your time this evening, and good luck to you and the staff at Helen Joseph. That's Dr. Jeremy Nell, Infectious Disease Specialist from Wits University with Helen Joseph Hospital.